Hello, everyone. So today I'm going to give you an idea of how doctors think. So, the most important thing in medicine is to be able to recognize red flags. So, for example, if you have headache, it could be benign if it's related to stress, if it's it feels like a tight band around your head, and it doesn't affect your quality of life. This may be tension headache, could be migraine, could be something simple. But if you have headache with neck stiffness, with fever, this may be meningitis, which is infection of the brain, of the layers that surround the brain, and this is very serious, could be life threatening. If you have headache that wakes you up in the middle of the night, if you have difficulty with your vision, if you have trouble hearing, difficulty speaking, weakness, this is concerning for some kind of brain tumor or malignancy that's causing you to have neurological symptoms. So this is a brief example of headache. Now we go to the second common chief complaint, which is chest pain. Chest pain can be something simple if it's related to heartburn, if you have just some heartburn and you're young, if you fallen and you start having chest pain and your chest is tender to palpation, if it's worsened when you take deep breath. This could be musculoskeletal, could be related to the pleura that surrounds the lung. This may not be something serious, but if you tell me that you have chest pain that associated with exertion and you are a smoker, diabetic, and hypertensive, this makes me concerned of possibly coronary artery disease, which means that some of the arteries that supplying your heart are blocked, and sometimes can be a heart attack. This is a risk of having a heart attack and your heart muscle die, and that's the reason for more than 500,000 people die in the US because of heart attack, myocardial infarction. If you tell me you have chest pain and some difficulty breathing, and you are tachypneic, you're gasping for breath, and you just traveled, you had a long travel, or you just had a hip surgery, or you are on some oral contraceptive pills, this may be pulmonary embolism, could be a clot that blocking your pulmonary artery that causing you to have difficulty getting oxygen into your body, and that may need urgent intervention, like getting the clot out. Just like the coronary artery disease may need a stent to put in there to open up the clogged arteries. So this is the chest pain. Now we talk about the third common complaint. Third one is back pain. So this is very common. We see that all the time. A lot of patients come with back pain. Back pain, if it is something simple, like you have back pain with walking and or with lifting something heavy, and you just had a new onset and you are young, it's not affecting quality of life. This is very important, quality of life, if it's affecting it or not. This could be pulled muscles. Usually it takes very long time to recover.